So regarding immunology, there is a hypersensitivity reactions, and these are very much high yield, especially their examples and their mechanisms, because board loves to go after hypersensitivity reactions. First one is type 1 hypersensitivity reaction, and in type 1 hypersensitivity, first of all, uh, discuss the examples. So anaphylaxis, like allergic related sepsis. Then we have the atopy. In atopy we have allergic asthma, and also there is urticaria, drug induced, especially the penicillins, which act as the epitope is the structure binding to the antigen binding site of the FAB antibody. Then we have a pseudo or false or mimicking type of anaphylaxis. In the pseudo allergic reaction, we have this opioid morphine, and it can cause pseudo allergic because it mimics hypersensitivity reaction. So these are all the examples. Next, mechanism, how this hypersensitivity works. So there is the immediate, which acts in the minute in immediate response, and there is a late response which acts in hours. So first of all, the allergen comes to the site, skin or respiratory mucosa. It cross links antibodies, especially the IgE, and these antibodies are preformed. They're present inside the body, already present inside the body. And how they will come? They will come by the pre-sensitization of the mast cell. So mast cell first sensitized, then first the allergen come, sensitize the mast cell and go. Then the mast cell learn that there is a type of allergen and how to respond to that allergen. Then the mast cell prepare some antibodies, especially the IgE and IgE, and prepare the body for the future related hypersensitivities against that allergen. So whenever the allergen re-exposed or re-enter or infect the body or the barrier of the mast cells, then the allergen cross-links with the antibody IgE and of the pre-formed and pre-sensitized mast cell. Then the mast cell degranulate, and when degranulation happen, mast cell has a lot of enzymes, which can cause different function. For example, histamine, and histamine is a vasoactive substance. Then we have the tryptase. So tryptase is important in is the marker of uh, mast cell marker, that either the mast cell are working properly or not. So this tryptase is pretty much important in a person which is allergic to something, and if we want to know that its mast cell are working, especially before using degranulation medications, or there is a failed therapy in the treatment of that hypersensitivity, then we consider a diagnostic test to measure the tryptase activity. So if this is high, it can indicate the mast cell are working properly, and we can use degranulation inhibitor medicines. And after this, it can cause hypersensitivity reaction. Then the antigen is not antigen persist, like it keep on stimulating IgE, and it happen after an hour. So after an hour, the mast cells, they releases chemokines, and which attract eosinophil. They attract more eosinophil, and also they call leukotrienes, and leukotrienes are important in asthma, because we give leukotriene inhibitors in asthma in order to relieve the symptoms or long-term prophylaxis. So leukotrienes, and which can cause inflammation and tissue damage. So this is the mechanism of hypersensitivity type 1 mechanism, and for this we have, in order to test this hypersensitivity, we have a skin test in which we give some allergen to that particular individual, and want to know that if the person is allergic to that thing or not, and especially it is in bee stings, we have hypersensitivity reaction. Drugs, I have discussed penicillin as an epitope. Then we have some food allergies. So these all under the hypersensitivity reaction. Skin test, and afterwards we can do ELISA to detect IgE levels. Afterwards we have type 2 hypersensitivity reaction. In this reaction, and in this hypersensitivity type 2, we have three different mechanism and three different mechanism related examples. So first one is, whenever the antigen goes to the antibody, it can do three things. Whenever the antibody goes to the surface antigens of the abnormal cell, then it can cause either cellular destruction. So the cellular destruction is either by the phagocytic cells including complement and macrophages, or cell destruction by the natural killer cell, which releases its granulozyme perforins, and it can cause cell destruction. And in this particular type, we have the examples of autoimmune hemolytic anemia, including the drug induced, which act as a hapten. So drug induced hemolytic anemia and also autoimmune hemolytic anemia. Then we have immune ITP or immune thrombocytopenia, in which the immune cells attack the antibodies or immune attack the antigen present in the thrombocyte and cause their destruction, which can lead to decreased level of thrombocytes. Then we have transfusion reaction, which we will discuss later on in the next lecture. Then we have hemolytic disease of newborn. So boards love to goes behind the examples and their respective hypersensitivity type. So you have to memorize this and conceptualize this whole data in order to ace the exam. And then we have cellular destruction. It is the first mechanism. Then antibodies goes to the antigen and do another thing, that is inflammation. And whenever I talk about inflammation is via Fc portion of the immunoglobulins, And we know that in our previous lecture that the FC portion has the two sides. One was the complement and one for the macrophages. So it can cause inflammation by macrophages and complement. And this can cause the examples of this is rheumatic fever rheumatic fever, which in which the heart cells act as an antigen molecular mimicry. It can lead to autoimmune destruction, autoimmune inflammation of the heart. And then we have good posture syndrome. Good posture syndrome related to glomerulus basement membrane. And then we have hyperacute transfusion reactions. So these is very much important. And then we have cellular dysfunction. Antibody go to the antigen of the cell, abnormal cell, and it causes dysfunction of the cell. This dysfunction mean it can block something, some channels, or block some enzyme, and it also down regulate or blockade the process. So the blockade or the down regulation, the examples are myasthenia gravis, in which there is a post-synaptic acetylcholine receptor antibodies, and Graves' disease, in which thyroid stimulating hormone receptor antibodies, and also Graves' disease. And there is also an example of pemphigus vulgaris, in which the autoantibody against the desmosome or desmoglein. So this is all the examples of type 2 hypersensitivity. And we also have a Coombs test, in which the Coombs test, and this test detect either the RBCs have the particular antigen or not. If the RBC has the antigen, then the Coombs reagent react with it, and it can cause agglutination, so that the test is positive. So if the RBC do not have this, then that agglutination doesn't happen. So this is Coombs test. And then we have type 3 and type 4 hypersensitivity reaction. The next one is type 3 hypersensitivity reaction, and it is all related with immune complexes. What is an immune complex? Immune complex is formed whenever the antigen bind with antibody. The whole complex is called immune complex, and it can cause a lot of inflammation, a lot of complement fixations, etc., etc. So whenever the antigen bind to our antibody, especially the IgG of the FC portion of the IgG, it can cause the immune complexes. These immune complexes can cause a lot of diseases. For example, vasculitis. So in the vasculitis, we have the polyarteritis nodosa, multiple arteries are involved. Nodosa means they can form a node-like structure like this. So they have some nodes. So this is called pan. And then also we have the systemic inflammation, in which SLE, rheumatoid arthritis, reactive arthritis, and post-streptococcal glomerulonephritis. These are all called systemic diseases. So the immune complex is responsible for causing all this fuss. Then we have the immune complexes, complement fixation, neutrophil attraction, lysosomal exam. Then we have Arthur's reaction. First discuss Arthur's reaction is actually whenever you give an intradermal antigen for a particular exposure or particular vaccination, especially the vaccination of the booster vaccination. So the intradermal antigen react or bind with the circulating IgG antibodies, and it can cause immune complexes, formation of the immune complexes, and this for immune complexes goes into the skin and lead to cause edema, also fibrinoid necrosis and complement activation. And adverse reaction happen with a lot of rabies vaccine, antitoxins, and booster vaccination, etc., etc. So this is a local subacute skin immune complex hypersensitivity reaction. Then we have serum sickness, which is very much important. Serum sickness, the first thing which I mention here is it is post 2 or 3 weeks, like it occur after 15 days. In the serum, it is a kind of sickness, in which sickness we have fever, in sickness we have, it is sickness mean fever. Then it I have mentioned is a immune complex hypersensitivity, so it can cause urticaria, also it can cause proteinuria, so it is immune complexes and systemic, and also arthralgia, lymphadenopathy post to 1 to 2 weeks. And in this way it can cause immune complexes deposition and complement activation, the same. And whenever the complement activates, it can cause decreased level of C3 and C4, which are the markers of complement pathway activation. Consumption, C3 decreased level, C3 mean the C3 as consumed. So type 3 hypersensitivity or serum sickness is very much associated with hepatitis B, and also it is associated with the monoclonal antibodies or penicillin, which act as haptens. This is all about type 3 hypersensitivity reaction. And next one is very much simple, type 4 hypersensitivity reaction. First of all, go for the diagram, so go for the examples. So there is a contact dermatitis, inflammation of the skin. Contact mean contact of nickel, contact of poison ivy, contact of euro shy oil, it's a kind of plant. So the person in the scenario, they mentioned that the person is going for a hiking camp in the forest, so it can later he developed a contact dermatitis or infection of the skin. Then we have PPD, we do PPDs for tuberculosis, and and after injecting that intradermal peptide, then then there will be a wheel, or we'll have a form on the skin, and we measure its size, and which relates to 5, 10, 15, and further on. This is a discussion of another topic. Then we have candida intradermal antigen test, which tests the integrity of T cells. So these three examples are very much important. The last one is the graft versus host disease in the transfusion reaction. So these are the examples. Let's talk their mechanism. So type 4 hypersensitivity is a delayed type of hypersensitivity reaction, and it has two mechanisms. It can cause either the direct pathway or the indirect pathway. In the direct pathway, CD8 positive cell goes and kill the allergen or the foreign antigen. But in the indirect pathway, CD4 cells goes to releases cytokines called macrophages and induce inflammation. So this is all about type 3, type 4, type 2 and type 1 hypersensitivity reaction.